This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Coming up this morning, we'll be talking to Dr. Wissam Gharib, cardiologist and director of structural heart at Mon Health Heart and Vascular Center. We will do that coming up in just a moment. We're going to take a quick break. We'll get to Dr. Gharib right after this on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. Wissam Gharib, cardiologist and director of structural heart at Mon Health Heart and Vascular Center, and friend of the show. Dr. Gharib, good morning. Good to have you on. It's been a little while. How have you been?
Good morning. Good morning. I've been very well. Thank you for having me.
You know, normally we always ask our guests to talk about themselves and talk about their background. You've been on the show several times. I was trying to think of something new to ask you. I'm going to continue thinking while you remind folks a little bit just about your background and how you ended up here in Morgantown.
Yes, I've been in Morgantown since 1990. I went to college here, then medical school. I did my residency here while I lived in Pittsburgh for a couple of years, but I've been a cardiologist since 2004, initially at WVU, and over the last 7 years here at Mon General.
Why cardiology? What, all the way back in the 90s, what sent you down this path and into this specialty?
Yeah, I've always been very interested and infatuated by the heart and the way the heart functions. The reason I chose cardiology, I really like the fact that you're able to see the patient who's, acutely having severe problems like a heart attack or other issues, and you're able to actually make a difference. You're able to actually stop the heart attack, or if they're having angina, chest pain, you're able to reverse this. And you're able to kind of do that in a very quick fashion, whether it's balloons, stents, or bypass surgery, or whatever it is that we are doing to our patients. We're able to see in real time the impact that we have on their lives. And that was always very fascinating to me, that you're able to actually help patients and be able to see it in real time.
All right, our subject this morning is AFib. In fact, September is AFib Awareness Month. We've talked about this before on the show, but what is AFib?
Yeah, so atrial fibrillation is a very common and a very dangerous disease, and unfortunately, a lot of times it's very silent. So atrial fibrillation is where your upper chamber of your heart is not functioning properly. So normally your heart, your lungs, your brain are all talking to each other and saying, hey, you're asleep, so slow your heart rate down, or you're running, speed your heart rate up. When atrial fibrillation happens, that's when your upper chamber is no longer functioning as part of the system. It's functioning independently, and it is actually functioning at a very fast rate. And it's so fast that it's very erratic. So the upper chamber is really just beating like a storm, and it's trying to beat at hundreds and hundreds of beats per minute. And then the lower chamber obviously says, I can't do that, I can't keep up. And that's what atrial fibrillation is. Now, that's multifold, so it causes all kinds of different issues. Some of it are very dangerous, like heart attacks and strokes, and we can talk more about that. And then the other part of it is when patients have symptoms that doesn't allow them to do the kinds of things that they want to do.
And that was my next question. What symptoms will present themselves that a person might be experiencing AFib, or what symptoms should prompt them to go, I better go get checked. There's something amiss here.
Yeah. So that's an important question. We need even more time to talk about it. But unfortunately, some of the symptoms are none. You can have no symptoms, and that's what we call silent atrial fibrillation. And that unfortunately leads to a lot of strokes. So if you look at all patients that come in with a stroke in this country, about a quarter of them have silent atrial fibrillation. So one of the symptoms could be absolutely nothing. Well, what are the other symptoms in those other 75% of people that have AFib, or the more than that have AFib? So you look for things like chest pain, shortness of breath, feeling dizzy or fatigued and tired, weakness, palpitations, and the last one, an important one is inability to exercise. You used to be able to go up a flight of stairs. Now when you're going up the stairs, you're getting short of breath, you're getting fatigued, you're getting tired. And those are all symptoms that can be from atrial fibrillation.
I bet you've heard this before. A patient comes in, you ask the questions about exercise and steps, and the answer is, I just thought I was getting older. I just figured I was getting out of shape. How can you tell the difference, or what's the difference between I haven't exercised or I'm not as in shape as I used to be, and maybe there's some AFib issues going on?
Yeah, it is hard to tell, and this is why it's important to see your doctor and see them regularly and have regular checkups, because a lot of people do exactly what you just said. They think I just thought I was getting older. I just thought I was slowing down. The biggest thing to look out for as a patient is when you have something change acutely. If last week or last month you were able to do something and now all of a sudden you're not, that's really important to seek acute medical care versus, waiting 6 months to see your doctor.
When you do see the doctor, there are options for treatment when it comes to AFib. So what options are out there to treat it and get you back to normal?
Yeah, so atrial fibrillation, you got to treat both sides. You have to treat the actual rate, and you have to treat the rhythm, and then you have to treat the consequences of those things. So rate, if you're having a very fast heart rate, that's very detrimental to the heart, so we want to kind of get that under control and slow down the heart rate. Rhythm, we would really like for you to go back into a normal rhythm, get you out of atrial fibrillation back to a normal rhythm. And while we do all that with medications as well as with ablations and the like, we also have to be cognizant of the fact that atrial fibrillation causes strokes. If you have atrial fibrillation, you're 5 times more likely to have a stroke than if you don't. And it's a pretty detrimental stroke, and that's why we also treat that portion with blood thinners. Traditionally, it used to be like Coumadin. Here over the last several years, decades now, we've started using newer drugs that, like, they're called NOACs, that's oral anticoagulants that are on and off. So Coumadin, you have to take it, you have to wait about a week to get it therapeutic, and you have to be very careful about what you eat and how you manage it. The newer drugs, you take them and they work, and when you stop them, they stop working, so they're a little bit more manageable. So that's the first line of therapy, which is blood thinners. And then there's other things that we'll talk about here later in the show that we can do if people can't take blood thinners.
Well, you can go ahead and bring them up now. If blood thinners are not an option, what treatment is available?
Yeah, we here at Mon lead the nation in some of the things that we're doing for atrial fibrillation. We are an AFib accredited center, which is very few people can say that they are. But also, when you have atrial fibrillation and we place you on a blood thinner, as you know, a lot of the patients that have AFib and on a blood thinner are actually frail, they're older, and they have other risk factors and other diseases. So you have unsteady gait where you fall, you have bleeds, gastrointestinal bleeding. Those all, or they're walking with a walker, those put you at a higher risk of bleeding or falling and having internal bleeding. So traditionally, when we had that problem, there was really nothing we could do. You either kept the patient on the blood thinner and hope for the best, that they don't fall again and have a detrimental effect, or you stop the blood thinner and, worried about having a much increased risk of stroke. So about 2016, the FDA approved a device called the WATCHMAN device. It's a small device that we actually go in the cath lab and place inside the patient's heart where all these strokes are coming from. That's called the left atrial appendage. So we're able to go from the groin up to the heart, put this device in, and about a month later, we're able to stop the blood thinner. And then the patient now has the same risk of stroke as the general population, and yet they don't have to be on a blood thinner. And that device has really been a game changer for a lot of our patients that really had no option. They either stayed on blood thinner and bled or stopped blood thinner and had a higher chance of stroke. And that's, we have the WATCHMAN device. We also have another device called the Amulet. We have led the nation in placing these devices, and we're also involved in a lot of the studies that are doing the advancements of those devices. Because, you start off with the first generation, and then we advance these. Now we're up to the third generation WATCHMAN. We're one of the few places in the state that actually do that.
We're talking to Dr. Wissam Gharib, cardiologist and director of structural heart at Mon Health Heart and Vascular Center. Got to squeeze in a quick break. We'll continue our conversation in a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Wissam Gharib, cardiologist and director of structural heart at Mon Health Heart and Vascular Center, is our guest this morning. And Dr. Gharib, can you talk about some of the advancements that Mon Health Heart and Vascular Center is making, right here in West Virginia?
Yeah, so there's so much to talk about. So the newest thing that we've started doing in atrial fibrillation, as we talked about earlier, trying to get you back into a sinus rhythm, it's called pulse field ablation. So what we want to do is we want to try to isolate that storm that I was talking about and try to get the heart to now start, again, listening to the brain and to the body instead of going at its own rate and rhythm. So what we're able to do traditionally is go through the groin, go into the left atrium, which is where the atrial fibrillation is coming from, and go into the pulmonary veins, which is the source of that storm that I was talking about. And traditionally, we would go place a wire and do an ablation, either via cryoablation with heat, with cold, or with RF ablation with heat, to try to basically isolate the storm and let the left atrium do its job, which is listening to the brain and to the lungs and to the body when it beats. So traditionally, we did that type of ablation. The newest advancements, and we were one of the first in the country to do this as well, is pulsed field ablation, where you're actually able to do this in a much faster fashion and actually do it in a much safer fashion. So it's faster and it's safer, where you're able to actually just affect where the storm is coming from. You're able to isolate it so that you no longer are communicating between the pulmonary veins and the left atrium, so that we're able to get the heart back into a normal rhythm. We've done this now I'm not sure exactly when we started. It was earlier this year. I'm not sure if it was March or April, but we've done this now on multiple patients, and it's the success rates have been very, very positive.
Do you ever sit back and take a minute and go, wow, I mean, we have come a long way from when you got, not to date you at all, Dr. Gharib, but just from when you got into the medical profession to where we are here in 2024. Do you ever just sit back and go, wow, we have really come a long way, and where we might go is just as exciting?
It truly, we're living in a very blessed time, and in cardiology specifically, across the board. I tell this to people all the time. If you miss a meeting, if we don't, we have regular meetings throughout the year where we're going and talking about advancements, and then we also on the side go to other meetings where we're actually helping to advance the field. And it's really amazing. If you miss a meeting in 6 months, you feel like you're left behind. Because it is an astonishing rate that cardiology is advancing, whether it's in atrial fibrillation, what's in other things that we do here at Mon, like valve replacements, like repairing mitral valves, replacing aortic valve. All these things, they're advancing at such a fast rate that you really, when you do sit back, it's unbelievable, the advancements that have been made and what we're able to do to our patients who are much sicker, much older. Yeah, we're able to do these procedures in a much safer fashion for the patients, and they have a very quick turnaround.
Before I let you go, we got a couple of minutes left. With all of these advancements and the exciting procedures, the WATCHMAN program, what you're able to do, whether it's through surgical treatment or using drugs, to help the patients. Do the basics still apply when it comes to heart health? Do the basics of diet, exercise, and obviously either not smoking or quit smoking, those still apply, right?
100%. We talk about treatment, but, the old adage still stands, a ounce of prevention is better than a pound of cure. So we are big advocates of talking to our patients. If you come to my clinic, every single time you come, I'm going to talk to you about diet and exercise. And we still are very interested in prevention because that's really the key. So we talk to our patients, talking about atrial fibrillation, since this is AFib month, obesity and atrial fibrillation go hand in hand. So we talk to our patients about diet and exercise. And, I still recommend 30 minutes of exercise a day, 5 days a week. We still recommend trying to get to your to the ideal weight that you can lose. And, we're not here to beat up on patients. We're all in it together, the patient, the physician. We're all talking together and trying to say, look, how can we prevent some of these things that are going to happen? And when they do happen, how can we help treat them better? So if we're able to exercise and diet, we can help get the atrial fibrillation under control, along with the adjunctive therapies that we've been talking about.
And
so, yes, it still stands.
And I don't want to overstep, but if you eat better, you exercise, not only is it going to help the heart, but if you are dealing with other issues, that helps not just the heart health, but that helps with other areas, maybe type 2 diabetes, other conditions as well, doesn't it? It applies all around, right?
Absolutely. It helps with your diabetes. It helps with your blood pressure. It helps your cholesterol. It helps with your osteoarthritis. So it's an all-around overall health well-being. So, yes, that's why we're pushing diet, exercise, not just diet as in weight loss, but also, staying away from ultra-processed foods, staying away from cigarettes, staying away from, those types of things. It's very helpful.
Dr. Wissam Gharib, our guest today, cardiologist and director of structural heart at Mon Health Heart and Vascular Center. Where can folks go to get more information?
They can go to our website, or they can call our clinic or our hospital, obviously 304-598-1200 to call the hospital. You can go to our website, monhealth.org, and you can get all kinds of information.
Yeah, you can head over to the website and get more information there. Dr. Gharib, always a pleasure talking to you. Always enjoy our conversations. Thanks so much for hopping on a Labor Day here today.
Absolutely. Thank you for having me.
Absolutely. Appreciate you taking the time.